Welcome to your open enrollment meeting. Attached is your open enrollment benefit book that you will be using throughout the year. So I highly recommend to keep your book handy, since there is a lot of information in there that you might be needing to go back to throughout the year. With that being said, again, welcome. My name is Ileana Miranda with Saposnik Insurance, and we're going to be going over your benefit options and changes for the upcoming year. If you notice in your book, you start out with your content page. Next page is your directory page. I consider this to be a very important page. Should you ever have any questions, any problems, any concerns, please feel free to reach out to your designated account manager within Saposnik Insurance, which is Robin Konikoff. Her email address and telephone number are listed on the bottom of that page. I always highly recommend to take a picture of that, keep it on your phone, or put it into your phone. Should you be out at a provider's and have any questions or have any problems, you could always feel free to reach out to Robin. We've also listed your human resource contact information and the individual carrier contact information. However, we do prefer for you to contact us directly, since you will get your answer a lot quicker and you won't have to be put on hold for some time. So please, again, feel free to reach out to Robin. Any questions, any concerns, we're here to help you throughout the process. Your next page, on page 4 of your benefit book, is your open enrollment highlights. Your eligible dependents are all full-time employees, and they are your partner and your domestic partner, and any child under the age of 26. Up to the age of 30, should they be their unmarried child, that you totally have total support for them. Otherwise, please understand, once you make your selections, you are not able to make any plan changes unless you are going through what is called a qualifying event. These are federal laws, so therefore, if you think you might be going through a qualifying event, please make sure to notify Robin within a 30-day period, since you do only have a 30-day window to make any necessary changes due to a qualifying event. On the bottom of page 4, we listed for you a few of the qualifying events that can occur that would be eligible for you to make changes mid-year on your plan. That would be a marriage, a divorce, or legal separation, the birth or an adoption of a child, a change in your child's dependent status, a death of a spouse, a child, or qualified event, a change in residence, or a change of employment. So for instance, if you currently have your spouse under your plan, but they get offered a position and prefer to take their new plan, or it's their employer's open enrollment and they'd like to go on board on their plan, then that would be a qualifying event for you to take them off your plan and they can be added to their plan. We don't expect you to know your qualifying event, so if you do think that you might be going through one, please don't hesitate to contact Robin so we can walk you through that. The benefits are all effective December 1st, 2019, and the employees are eligible first of the month following 60 days of hire. The benefits available are medical, dental, vision, employer paid basic life, voluntary life, the employee assistance program, and supplementary insurance. The HIPAA enrollment notice is listed there as well as on the bottom of the page, terms that you need to know. Your deductible is basically the amount that you pay for the services that actually list deductible applies. If when you're going through your benefit you just see a co-payment, please understand that is all that you pay for that service. So deductible only applied for covered services where your insurance coverage states that deductible applies. The co-insurance is a percentage of the cost of the bill that you would be responsible after you've met your deductible. And again, it only applies for services that list that. Your out-of-pocket is the highest amount that you will ever have any financial responsibility for. And I will go more in detail how that works once we go through your plan benefits summaries. If you have any questions, again, feel free to reach out to Robin. Your first plan, understand that your plans did change, and this change will be effective December 1st. this current year, or you currently have Florida Blue, or your medical plans will be changing from Florida Blue to United Healthcare. Please note that on the top of every page you have your provider network. The name of this network is NHP-HMO/POS Access. All these plans are open access, and what that means to you is that you never need a referral. So if you should ever need to seek a provider, please feel free to just confirm that they are part of the network, but you do not need a referral. That's what open access means. As you can notice, this plan on page 6 is a point of service. That's what the POS stands for. So that means you have in-network benefits and out-of-network benefits. I highly recommend for you to stay in-network, because when you're staying in-network, you're protected by the contracts that the insurance company provides, or that United Healthcare has with your providers. So they can bill you whatever they want. Otherwise, if you go out of network, which is an option on this plan, please understand that there are no provider contracts. That means that they can bill you whatever they choose to bill you. You're not protected by any contracts. Please note, out of network, that your deductibles and your benefit is a lot lower than, and your financial exposure is a lot higher. So again, I cannot stress enough, when you have a point of service plan, to always verify that your providers are in network. The deductible on this plan is $5,000 for a family, $10,000 for, $5,000 for an individual, $10,000 for the family, with a 30% co-insurance. Keep in mind the co-insurance, the deductible, only applies for the services that listed as applicable. Your out-of-pocket maximum, which is the figure that I just mentioned a little while ago, is $6,350 for the employee, $12,700 if you're including a family. So what does that mean to you? That means that everything that you pay on the plan, be it any office visit co-payments, your $5,000 deductible, anything you pay of your 30% responsibility, it all gets thrown into this bucket. If at any point you reach your $6,350 for the individual, that means that that is your maximum financial exposure any given year. At that point, the plan starts to pay at 100% for the remainder of that year, or $12,700 for a family. All benefits are unlimited, so whether your medical bills are $100,000 or $2 million, they never end, and you are protected that the maximum financial exposure is a $6,350 for the individual, $12,700 for the family. If you would need office services, your physician services, this would be are considered your primary doctors, which are your general practitioners, family practitioners, internists, pediatricians. Your office visit copayment is $30. Every other type of doctor is considered a specialist, and your copayment is $55. Please note that these have copayment, so the deductible does not apply on these services. And a referral is not necessary to go to your specialist, since it is an open access plan. Your preventive care on all your plans are covered at 100%. In network. So please take advantage of your one annual visit a year. Prevention is the key to a happier, healthier life. What will be covered under that preventive visit would be anything that is determined by the American Medical Association as part of your routine annual checkup based on our age and gender. Please make sure that when you go for your preventive visit that you are healthy. It is covered at 100%, so that means there are no co-payments that apply to this service. So you pay nothing for blood work, let's say, you pay nothing for your office visit, you pay nothing for any tests that need to be performed that are part of your preventive visit. So when you go to the doctor, make sure to let them know that you are healthy. Because if, for instance, you say, by the way, I have an earache, I have a sore throat, then that will no longer be considered a annual preventive visit. That would be considered a diagnostic visit, and then you will be charged for the copayment for the visit. So in order for the visit to be completely covered at 100%, your annual visit, you do need to be healthy. And it is every 12 months from your last annual preventive visit that is covered. As far as your diagnostic services, your labs are Quest and LabCorp, so you have the two biggest labs that are part of your network. It is subject to the deductible, and you're responsible for 30%. So how would this work? Let's say that you're sick, your doctor says you need lab work, but you have not met that $5,000 deductible. So what you're going to pay, because you're going to Quest or LabCorp, it is in network. That means that they have a contract with United. You're going to pay the contracted prices for that lab work. The average lab work cost is $80. So that's, and again, this is just an example. You pay whatever the contracted prices are for the services. Anything you pay goes towards reducing your deductible. So let's say that lab work was $50. Well, now your deductible went down by the $50. And that's how you slowly meet your deductible. So you're going to notice a lot of the times, if you're relatively healthy, you will never have to meet that deductible. You can just go along through your co-payments. Same thing with your MRI, CT scan, PET scans. You need any of those higher type of diagnostic services, it is also subject to the deductible. So what will you pay? Well, you're going to pay the contracted price for that MRI. Here's where I'd like to give you a little bit of tips, which is also the point for this presentation, for you to understand how to best use your benefits and to pay as little as possible for the co-payments on your benefits. So in this particular case, your deductible is subject, you are responsible prior to meeting the deductible. So if you need an MRI, CT scan, or PET scan, first of all, I'd like to highly recommend, rule of thumb, to always steer away from hospital-affiliated providers for any type of services that are in the hospital, unless you are admitted. The reason for that being is that hospitals negotiate very expensive contracts with insurance company. So an MRI at a hospital might cost you $1,000 versus at a freestanding diagnostic center might cost you $300. So it's a big difference. And because the deductible is applicable on this service, that means you're going to be paying for that out of pocket. So it'll cost you a lot less paying $300 for that same MRI versus $1,000 if you get it done at the hospital, since the deductible of the $5,000 applies on this service. So just to make it easy for yourself, just always keep in mind, try to get all your services rendered at providers that are not part of a hospital. Unless, of course, you are admitted, then you have no choice and you do have to go to get those done at the hospital. Your emergency and urgent care services, your emergency room is a $300 copayment. Again, please keep in mind that emergency rooms should be used for life-threatening situations. Severe profuse bleeding, loss of consciousness, chest pains, but any minor things like a fever, vomiting, you should really go ahead and go to an urgent care. As you can see, the big difference in the copayment for the urgent care is only a $60 copayment. So then I highly recommend to always use your urgent care centers versus the emergency rooms. Now, keep in mind, urgent cares are not open 24 hours, 7 days a week, so we do have to be a little bit proactive in that sense, going to your network. Once you have created your portal to NHP HMO/POS Access, that is the name of your network, that you will be searching for the closest urgent care that is open 24 hours, 7 days a week. And you can search by zip code. For your out and inpatient services, that would be ambulatory surgeries. Again, the same rule applies. If you're going to get an outpatient surgery, that means you're in and out of the hospital on the same day. That basically, I would highly recommend to get that done at an ambulatory surgical center that is not part of a hospital, that is freestanding. You're going to, again, notice that it will cost you a lot less getting it done at a freestanding center versus in the hospital, since this service is subject to the deductible and the 30% co-insurance. And of course, if you're admitted to the hospital, then you've got no choice. You got to go into that hospital. It is subject to the deductible and the 30% co-insurance. The same thing for the providers in that hospital. Your prescription rider on this plan are $15 generic, $60 your brand name, $150 out to $300 your non-formulary medications. This plan mirrors exactly the same exact benefit, with the exception of the labs as your prior coverage through Blue Options. So the benefits are very similar. Again, on this benefit, please steer away from out of network or patient type of services. Always try to get those done at providers that are not part of the hospital. Your next set of benefits that's being offered to you is also a point of service plan. That means you have in-network and out-of-network. It is also open access. And if you notice, it is the identical network. So the list of providers are the same within the two plans. They do not vary. On this plan, your deductible is $1,500. $3,000 for the family with a 50% coinsurance. If you go out of network, notice how it doubles up. Your deductible is $3,000, $6,000 for the family, and coinsurance is 50%. Your maximum out-of-pocket exposure on this plan, if you stay in network, is $7,900 for the individual, $15,800 for the family, versus going out of network is $15,000 for the individual. So you really want to steer away from going out of network. And again, all plans are unlimited, so your benefits never expire. Your physician services are $45. Your specialists are $120 copayment, and again, no referral is needed. Your preventive, as I mentioned earlier, covered the same as with the prior plan, covered at 100%. Your labs and your MRIs and your emergency rooms are all subject to your $1,500 deductible and at the 50% coinsurance. So what does that mean? Just to reiterate, that means you're going to be paying the contracted prices for those services. Whatever you pay gets thrown to lower your $1,500 deductible, and that's how you reach the deductible. And again, unless you're really ill, you'll rarely reach that deductible. Your urgent cares are a copayment of $50. Again, keep in mind, urgent cares aren't open 24 hours, 7 days a week. So find one that's close to you that is open 24 hours, 7 days a week, and program it into your cell phone so that, God forbid, when the emergency arises, you'll know where to go and only pay $50. Same services for your outpatient and inpatient services is covered after the deductible at 50%. Your prescriptions are $15 for your generic, $60 for your brand name, $150 for your non-formulary medications. Your next set of information is your Care 24 with United Healthcare, which is really a wonderful service to have. You do have a 24-hour, 7 days a week nurse line. I highly encourage, and their number will be on the back of your ID card, to, if you're sick, prior to rushing off to an emergency room or to an urgent care, to call the nurse line. They will triage you, ask you questions as to your illness or your symptoms, and let you know what you can do, if you should maybe take something over the counter that you might have at home and they'll call you back, or whether you should be going to the urgent care. So do use that free nurse line. It's very helpful, especially if you have children. I highly recommend to use the nurse line. Then you have your employee assistant program, which is totally free, totally confidential, 24 hours, 7 days a week, assistance in dealing with stress, depression, anxiety, personal, financial, legal problems, parenting, and family problems. And the information is listed on Getting Connected on the bottom of page 8. To view your ID, you can check your account balances. Once you register into the portal, it's very informative. You're looking for a provider, you're going to need to search and remember your provider directory name. It'll automatically take you to your provider network. So when you receive your ID card, please register. And once you do that, you can see all of your information. It also has a lot of informative tools. And here's a little bit of information as to some of those tools that the site has once you register. You can, health cost estimator is a really important one. So if you're having an ambulatory surgery or an MRI, based on your current and existing benefits, it will tell you where it will cost you the less to receive those services. So read this page at your leisure. Also keep in mind, it's also very important, at the bottom of this page is your virtual visits. You only pay a $10 copayment. So that means that if you need to see a doctor, you're going to schedule your virtual visit either through your computer or through your cell phone, and you're just going to pay a $10 copayment versus a $30 copayment on your first plan option or $45 on your second plan option. So substantially less for using the virtual visits. They can write prescriptions, and you will be speaking to an actual MD. So the information is listed on the bottom of page 9. Next page is your dental coverage. Your dental coverage is through United Healthcare. Last year it was through MetLife. The benefits were mirrored identical, so there were no benefit changes whatsoever. You have your HMO plan. Your HMO plan is subject to, this is your vision. I need to go back. This is your dental plan on page 10. Your dental plan, you have two dental plans, your HMO plan and a PPO plan. The benefits did remain identically the same as last year. You just switched from MetLife to United Healthcare. The deductible, there's no deductible on your HMO plan. You have a $5 office visit. Your preventive visit are covered at 100%, and all your other services on your HMO dental plan are covered at the negotiated prices. So there is a fee schedule with the DHMO dental plan that basically lets you know, based on your code or on the code of the procedure, what your responsibility will be. It will be based on negotiated prices with the dentist. On the DHMO dental plan, please note that you do have to go to the dentist listed on your ID card, and that you should always you don't have out of network, so you do have to stay in network on your DHMO dental plan. It is the more affordable plan. It is another big difference between the plans is that on the DHMO dental plan, you do have orthodontic covered that is covered for adult and children, and that there are no maximum benefit amounts. So the benefit never ends with the DHMO plan. Versus your national PPO dental plan, it has an annual deductible of $50 for the individual, for yourself, for the family, maximum $150. Preventive is also covered at 100%, and that would be every 6 months on the dental plans. You can go for your preventive visits. It's covered at 100%, your regular checkup from the dentist, your x-rays, and your basic cleaning. Your basic services on the PPO are covered at 80%. Your major services at 50%. Your periodontic and endodontic, those are issues having to deal with your gums, are covered under basic. That means that it's covered at 80% on the PPO plan. The PPO plan does have an annual maximum benefit amount of $1,500. Orthodontics is not covered on your PPO plan, not for adults or for children. So keep that in mind when making your selections. Next is your vision plan that also changed from MetLife to United. The benefits are mirrored exactly. Your eye exam is a $10. This you use once a year for your eye vision exam. This, if you have a disease of the eye, please understand this is covered through your medical plan. This is just for getting a checkup for contacts or glasses. The exam is $10. You can get that checkup once every 12 months. The materials would be a $25 copayment. There will be single, bifocal, trifocal, or lenticular after your copayment. Frames, they give you up to $150 towards the purchase of your frame, and if you go over that, an additional 30% discount will be issued to you. There's an improvement here. Last year, your frames, you were issued $130 towards the purchase, so here you have a little bit more of a benefit of $150 towards your frame. The frequency of your frames are every 12 months, where last year it was every 24 months. So now you can get your frames also every year. If you need contacts, then it would be up to $40. Electives, now understand you can either get contacts or glasses. You cannot get both during the same plan year. So if you select to get your glasses this year, then next year you might want to get your contacts, or vice versa. Your next set of benefit is on page 12. That would be your life insurance benefit. You get free employer paid basic life insurance of $10,000. Please understand when you enroll to make sure to name a beneficiary. This plan includes accidental death and disbursement. What that means is that if God forbid you die due to an accident, the $10,000 doubles up to $20,000. So make sure when you make your selections and you do your enrollment to please name a beneficiary. I always recommend for it to be an adult over the age of 18, since insurance companies do not pay benefits out to minors. So they would hold on to that benefit till that minor reaches the age of 18. You can also purchase additional voluntary life insurance. And again, this remained the same as last year. You can purchase increments of $10,000, not to exceed 5 times your annual salary. Maximum amount of the coverage would be up to $500,000. The benefits are portable, so you can take these with you if you ever are no longer part of responsive home care. You can take these benefits with you. You can also purchase life insurance for your spouse and for your dependent children. Next page. On page 13 is your employee assistance program through MetLife. So you have 2 employee assistance programs, one through United and one through MetLife. They're there for a whole bunch of services, grieving, and it's all confidential, totally confidential, 24 hours a day, 7 days a week. So feel free to read that at your leisure. You also have your Colonial Life supplemental policies that you can purchase. You have your disability. This is an important policy. This is the insurance for your paycheck. You have the accident insurance policy. This pays you should you have any accident. They're not going to pay the provider. The money's going to go to you. So if you have a cut or a burn, you go to your urgent care, you submit a claim, and they'll pay you based on the type of injury. And the critical care policy that also pays you if you're diagnosed with a critical illness. Medicare Part D is just giving you, which is letting you know that all your benefits exceed the Medicare Part D allowable. And you can read that on your leisure as well. Then the next following pages are referring to laws that we want you to be familiar with. There's the disclosure for the Section 125, the HIP, and the COBRA. And again, you can read this at your leisure. That's why I mentioned this is a very informative book, and Responsive does want you to be familiar with your laws and rights. There's a Women's Health Care Right Act on page 17, the Newborns Law, and the CHIP program for those of you that need to insure a child. The 800 numbers listed on that page. Education, we're very much into education, making you aware of how to best use your plan and how to keep the money in your pocketbook and not give it away to providers. So this is a really informative page. I'm on page 18, how to reduce your prescription drug costs. There's a lot of generic programs out there through Publix, CVS, Walmart, Kmart, where you're going to find that a lot of the times you can purchase your generic medication for a lot less than using your insurance ID card. So I highly recommend whenever you get a prescription to always look into these options. There are a lot of generic medications that are $3, $5, some antibiotics that are even free. So why are we going to pay $15 for your generic medication, which is your coverage through your medical plans, if you can purchase them for a lot less? So always look for alternative options when purchasing medication. For your brand name, on the bottom of that page, I also highly recommend to go to GoodRx. It's really huge discounts, and again, you might be able to save a lot of money since your brand name prescription rider in your medical plans is $60. You might be able to purchase that brand name medication through GoodRx with a discount that they give you. You could go to whatever pharmacy of your choice and get your prescription for, again, a lot less than the $60 copayment, which is a designated amount for your under your medical plan. And again, education when it comes to when you're sick. Who should you be calling? Do I do the telemedicine, the doctor, or do I go to an urgent care, an emergency room? We've tried to help you a little bit with this to make it a little easier for you, and listed a couple of situations, conditions, and illnesses for you to really be able to choose what is your best bet and where you should be going. Again, this is not only time saving for you, but also a cost savings to you as well. If you keep in mind your telemedicine COVID payment was only $10 versus going to a primary care, depending on the plan that you select, could either be a $30 copayment or $45, depending on the plan. So again, keep this in mind whenever you're going to be needing those services. And again, here's some more information how to stretch your dollar as far as your doctor's visits versus hospitals. And I already explained this a little bit to you through the presentation, and the pharmacy and how the pharmacy works, and talking to your doctor. Also, when it comes to medications, if he gives you a brand name, are there generics? Can you take the generics? Since generics are always going to be a lot less expensive than your brand name medication. That will be up to your physician to decide, but it's a good conversation to have and to discuss with your doctor. And again, we should know our numbers on page 22. What is your blood pressure, cholesterol, blood sugar? Read these on your own. We tell you a little bit about this so you can be proactive. Same thing with your financial wellness. So there's information regarding that. And that about concludes the presentation. If you have, again, any questions, any concerns, feel free to reach out to Robin Konikoff. She is your go-to person and your designated account manager. And again, welcome to your open enrollment, and hope that you're excited. This is really great time of the year. And if you have any questions, again, don't hesitate to reach out to us. Thank you.